So, is it possible to treat a lazy eye with virtual reality? I'm actually going to show you how this actually might be a legit treatment for a lazy eye. Let's focus in. So, recent studies have actually gained FDA approval by a company and a virtual vision therapy program called Luminopia to help treat a lazy eye, or what we call amblyopia. But how does this actually work, and what all can it actually treat? So for the catch-all term for lazy eye in the eye world is called amblyopia. This meaning where one of the eyes is blurred because the connection from your eye to your brain is not working together effectively. Now, normally how the eyes are supposed to work is when light enters the eye focuses a clear image to the back of the eye. The back of the eye then sends these electrical impulses to the brain, and then it's the brain's job to interpret and process and develop the vision. So really, our vision is actually happening in the brain. Now, if something interferes with the image or from the signal that the eye sends to the brain will have a harder time deciphering and processing vision in that eye, to the point that it might neglect that eye and spend all of its time and energy developing the better signaled eye, the better visioned eye. And this can lead to development of amblyopia in the weaker eye. And after a while, if there aren't strong neurological links from that eye to the brain, this actually can have long-lasting effects later in life, that eye constantly being the weaker eye. Even if we provide the best prescription glasses to try and help the vision, it will still be the weaker eye because the brain has said, nah, that eye gave me too much trouble. I'm just going to focus on this eye. And that's why this is so important to catch this earlier in life, before someone's 10, 12, 14 years old, so you can actually provide treatment to strengthen the connection of that eye to the brain, that you can strengthen the neural link and actually improve the vision, improve the function of that eye. Now, there are three main causes for amblyopia, or a lazier, weaker vision eye. One being refractive error, where you have one eye that has a much stronger prescription. Either that eye is way more farsighted than the other eye, has more astigmatism than the other eye, and so because that eye is constantly the more blurry eye, the brain will start to ignore it, won't develop the connections to that eye, and will favor the better, easier seeing eye, and will develop strong connections to that eye. Number two is an eye turn, or what we call a strabismus. This can be an eye turn in, out, up, down, and because that eye is pointing in a different direction, you'll have a misalignment of the images going to the brain. Sometimes it can actually cause double vision. And so because if you have one eye that's the rogue, troublemaker eye, the brain will say, you know what, that eye is giving me too much trouble, I'm not going to even pay attention to it, and I'll develop a strong connection with the better eye. And the third one being visual deprivation, or something that is actually blocking the light or blocking the image getting to the back of the eye. Big ones here would be cataracts. A lot of times kids can be born with cataracts called congenital cataracts, or sometimes ptosis, where their eyelid is droopy enough that it's actually blocking enough light. Now, the main treatment for this, the main goal, is to try and provide a clear single image coming through both of the eyes, so the brain actually has a chance to develop connections, especially towards that weaker eye. So if that patient has a much stronger prescription in that eye, we definitely want to get them in glasses, providing the best, clearest image to both of the eyes. If the person has an eye turn or a strabismus, you need to address that either through surgery if it is really severe. You can also do some vision therapy. Sometimes that can help correct a mild strabismus. Also, sometimes just by wearing glasses, depending on if that eye turn is linked with a higher prescription, sometimes that can help straighten the eye out as well. So in either case, you're going to want that patient in their best corrected glasses. And then if there is deprivation or something occluding the vision in that eye, we need to try and remove that. Cataract surgery, eyelid, getting the eyelid out of the way. So it depends on the patient there. Now, if that patient has already started developing amblyopia, meaning even with their glasses, the one eye, the weaker eye, cannot see as well as the other eye on the line chart, then usually that's when amblyopia treatment is introduced to try and strengthen that weaker eye. Probably the most common treatment that's been out for a while is patching, where you actually patch the better seeing eye. That person's going to wear their glasses, patch the good eye, and force the weaker eye to do everything with the vision, hopefully forcing the brain to make the connection to that eye. Now, usually this is done from 1 to maybe a few hours every day, so it is work. Another treatment that's been around for a while is the use of atropine eye drops. Atropine actually dilates the pupil and relaxes the focusing muscle. And so if you do that in the better seeing eye, trying to kind of decrease the vision a little bit in that better eye, the same thing will force the weaker eye to do everything with the vision. Now, as you can imagine, with a child, whether you're patching or doing eye drops, there can be a lot of tantrums and fights and crying, and can be a battle to do this treatment for an hour or multiple hours every day. And so compliance rate can really fall short because it really is a battle, and sometimes you just don't want to do it on this day or don't want to do it ever because it's just such a headache. And this is where Luminopia comes in, a digital vision therapy that actually kids might like to do. So how this is set up, the child is provided with a VR device and a program where that child will watch a video or shows for an hour or more each night. And these shows and program are specifically designed to treat amblyopia. And how it does this is that for the weaker eye, it shows a much more vivid image, a clearer image, and then for their stronger, better seeing eye, it's a reduced contrast image and maybe a blurry image. And so while they're actually watching a show, they can actually still watch it, enjoy the show, but it is showing the better image to the weaker eye, which will encourage neurological links to be created in that weaker eye. Now, going over the study that actually gained FDA approval for this device. In the study, they actually took 4 to 7-year-olds that had amblyopia and split them up into 2 groups. One group, wearing their glasses, actually did Luminopia for 1 hour each night for 6 days out of the week, and they did this for 12 weeks. The other group just wore their best corrected glasses. They didn't do any other amblyopia treatment. They just wanted to see how it compared to just wearing glasses. At the end of the study, it actually showed the group that did Luminopia had 2 lines of visual improvement on the eye chart, whereas the group that just did glasses had 1 line of improvement on the eye chart. So pretty much you had double the improvement with Luminopia, which is amazing. And the most amazing part was the compliance report. Parents and patients reported 85% compliance, which is incredible compared to patching and eye drops. And on top of that, in that group, some of those patients had done patching in the past, and the parents reported 94% preferred doing Luminopia over eye patching, meaning that the fighting and tantrums and the battle was almost non-existent with Luminopia. So I actually see this being a really good amblyopia treatment option. And because it's FDA approved right now, it is available right now. Now, it is a prescription from your eye doctor. If you are prescribed that, they'll send you the headset with the program and the shows included in there. And actually, when you're doing it, your eye doctor can actually watch the compliance rate. There's a program where they can actually monitor the progression as well. And so it can actually be a really good option now because it is new. It's a new treatment. There probably is going to be a battle with the insurance coverage. Now, that being said, who will this actually work for? There is a specific category of amblyopia that this will actually work better for. It's usually those people that do have refractive amblyopia, so meaning their bad, weaker eye is due to a higher prescription, so they'll be wearing their glasses when they do Luminopia treatment. Also, some people that have a mild strabismus or a mild eye turn can also show improvement with Luminopia. So I don't want you to leave thinking this is actually going to help with my lazy eye turn. If you have a big eye turn, it's not going to straighten out that eye. If you have a mild eye turn, a mild strabismus, it could help the vision in that eye. It could help strengthen the connections from the eye to the brain. That's what this is going to help for. That's where it's going to shine. And you can also count on other companies and programs coming out here in the new future. There is one that's called Verve that is working on FDA approval as we speak this year. And so you're going to start seeing other virtual reality binocular therapy programs and tools that people can use, that doctors can use to help strengthen amblyopia, which I'm excited for because I really do think this can help with compliance rate, help those children, help the battle, help the parents, help the children. That's the main idea right there. So who knew, with the world of new technology, virtual reality, the unknown of what this can actually do to your eyes, it actually can be used to help strengthen eyes, help treat amblyopia, and I kind of find that cool. And so I wanted to do a video about it. If you have any questions about it, check out the description. I'll put links to further resources, or you can leave them in the comments and I'll answer them there. Thanks for watching, and stay focused.